Those with the greatest need for health education may have the least access to information. According to the Office of Disease Prevention and Health Promotion, people with low health literacy skills have an inability to read and understand health literature, navigate the healthcare system, the healthcare marketplace, and critically evaluate health messages in the media. Populations with low literacy report poor health, incur higher healthcare costs, and possess lower knowledge of medical conditions than populations with higher health literacy skills. The West Virginia Department of Education has a health literacy policy using nationally recognized content standards and objectives. It is our goal to advocate for a provision to the current policy be made as to include for a required time of 12 weeks with 5 class settings a week in 6th through 8th grade. This would allow the opportunity for students in West Virginia middle schools to accomplish health literacy. The current policy does not require specified times be set for health education in middle school. With all the push on test scores in math, science, and language arts, many administrators are allowing health education in West Virginia middle schools to go into a status of neglect.
The West Virginia State Board of Education states in Policy 2510 that health education instruction is required for students by grade level from kindergarten through the 8th grade.
That policy does not set a time when this is to be done, thus no class time is devoted to it.
Consider how involved the policy is by reading what West Virginia wants. Health literacy for all students is a fundamental goal of a comprehensive school health education curriculum. The health literate student is a critical thinker, a problem solver, and a self-directed learner, an effective communicator and responsible, productive citizen. Students must have the capacity to obtain, interpret, and understand basic health information and services and the confidence to use such information and services in ways that enhance a healthy lifestyle. A comprehensive school health education curriculum from grades 5 to 12 is essential to enable students to acquire and apply health learning knowledge, skills, and behaviors.
With the limited amount of time I've been in health class, my question is exactly what is health? I looked it up and found that the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The WHO also points out that this definition has remained unchanged since 1948.
Well, if all we have to know is that health is physical, mental, social, and emotional, what is all the fuss about? I just remember that in all of 2 minutes.
Wait a minute before you jump to that conclusion. When health education is put into perspective and the effects it can have on our lives, it is really important. It's my body, my brain, and my feelings, and everyone I come into contact with. These all have to work together and are under constant change and influenced by outside forces. Our health knowledge affects our lives and everyone around us. Health education is important and needs to be treated with more dignity.
Let a man figure this out, mathematically speaking. I will show it where it is in our situation. We have been in middle school 4 years. There are 180 teaching days a year. 4 times 180 equals 720. We have held 2 class periods a week for 6 weeks. In 6th and 7th grade at 40 minutes a class, 12 times 40 equals 480, times 2 equals 960 minutes. Divided by 60 equals 16 hours, divided by 8 hours a day, 2 days out of 720. Not very much time to become health literate.
By the way, for all you mathematically inclined men, that is only 2.2% of class time devoted to health education in grades 6 to 8 in my school.
Not to mention the fact that they test us on health knowledge in the 6th and 8th grade. Do you remember the 40 question test?
I think it was called the HEAT test, the West Virginia Health Education Assessment Project. I looked at the results for last year, and in 2014, the 6th grade overall health knowledge score for the state was 74%. The 8th grade came in at 68%. Those scores do not make middle school students in West Virginia have to be very health literate. Where do we rate in the health index as a state? The facts are that West Virginia suffers from several health-related issues. Overall health rankings place West Virginia at 46 out of 50 states on a health index. While birth rates have dropped in the last 10 years, West Virginia has had a rise in teen pregnancy and birth rates since 2006. West Virginia obesity rates continue to rise. All of these behaviors can result in higher morbidity and mortality rates as we age. West Virginia health education needs attention.